I'm Dr. Evan Allen. I'm a board-certified family physician, and I'm the medical director here at Allen Wellness and Medical Center in Henderson, Nevada. We're continuing our series on the book Wheat Belly, and I'm going to talk about the first chapter today, which is about the obesity epidemic in the United States. Now, a book called Wheat Belly that starts out talking about the obesity epidemic, you would expect to include a lot of facts and figures that directly link wheat with the obesity epidemic and shows clearly that no other competing explanation of the obesity epidemic in the United States would make sense. Now, nobody disputes that there's an obesity epidemic. Anybody with eyes in their head can see that people are much heavier than they were 20 or 30 years ago. So that's not in dispute. The question is wheat the cause? Well, when we investigate that, we find that it really doesn't hold up and it really doesn't make any sense. So when we look at consumption patterns all over the world, the places that consume the most carbohydrate as a percentage of their dietary calories have the lowest rates of obesity. And conversely, when we look at the map of the world, the places that consume the highest amounts of fat and protein have the highest rates of obesity and the highest rates of diabetes. So this alone makes you sort of skeptical and questioning what might be there. But it gets even more complicated. When we look at large-scale nutritional studies, studies of hundreds of thousands of people, what we consistently see is that the people who eat the most whole grain are the slimmest and have the lowest rates of diabetes. The book has an opportunity to tell you exactly why it thinks that wheat is the primary cause of the obesity epidemic, but instead it distracts you and asserts without showing. And it doesn't even bring up the numerous studies of which I ran out of time to even catalog that show consistently over and over, study after study, that the people who eat the most whole grains have the lowest body mass indexes, that means the lowest obesity rates, and the lowest rates of diabetes. So the book simply fails to accomplish that, and I recommend against paying attention to it. In an interesting side note, the author does describe what he used to eat, and he ate large amounts of pancakes and waffles. He would have fettuccine alfredo for lunch. He would have Italian bread, I'm sure with butter on it, for dinner, and for dessert he would have a poppy seed muffin or angel food cake. Well, he was getting eggs in the batter of his pancakes and waffles for breakfast. He was getting, butter and cream in the sauce of his fettuccine alfredo, and often fettuccine noodles or egg noodles. And he was getting eggs in his poppy seed muffin and angel food cake at bedtime. So you could just as easily identify his problem as eggs. Well, when we look at egg consumption, what do we see? 68% increased risk of diabetes in people who eat a lot of eggs. Yet the book suggests that if you're really heavy, you should be eating lots of eggs. Egg consumption is associated with obesity in studies. So I think the book could easily have been more about how getting rid of eggs would make you healthy, and it would have been much more accurate. Even for people who have celiac disease or gluten intolerance, adopting the recommendations made in this book would lead to them having overall worse health. However, people with celiac disease or gluten intolerance should avoid gluten, but they should not avoid carbohydrates. Thank you very much. If you have further questions, there's a blog post that we're going to post as well. It's going to go up on our website at www.allenwellness.com. Thank you for your time.